With around 70 million displaced people globally, we are currently facing an unprecedented refugee crisis. This is reflected in the 22% increase in various forms of protection offered by the UK government in 2019. Back in 2015, many of us were shocked by images of desperate people travelling by perilous means, risking everything to seek safety, but sometimes not surviving their journey. A group of concerned people came together forming Refugee Action Colchester. Initially, our work focused on volunteering to support the thousands of people stuck in Calais. Recognizing the growing number of sanctuary seekers in and around Colchester, our focus shifted to address the local need. Despite not having the necessary resources, we sought to deliver positive outcomes in profoundly challenging circumstances. Also, not having access to office and IT facilities meant relying on volunteers to commit their own funds and resources to support the work of the group. The growing demands for our services led us to start the process of formalizing our group. We established Refugee Action Colchester CIC and successfully applied to the National Lottery Community Fund for a development grant.
So this transition process has been quite a major step up from a grassroots, unstructured organisation into something which is hopefully quite structured, but what we've been really keen to do is to keep the immediacy and the flexibility and the values of the grassroots structure. So we looked at what we thought the organisation was about and we literally made pictures of it. And the most interesting picture I saw was an eye. And what it said was, we see you as a whole person and we want to accompany you while you settle in, while you belong in Colchester. And hopefully that is what it means to be welcome. We've created a situation where we've separated what we're doing into sections or work streams, and now we're looking at a proper structural organisation where each of the work streams has a team of people. So instead of two people doing everything and the rest of us kind of holding them up, we've actually created teams which each person has taken responsibility for, and this allows us to make use of our volunteers, because where we started and where we still are is a network of volunteers, a huge network of humanity really across Colchester. So the organisational structure is now fairly clear and it reflects what we've been doing. We're training our volunteers, and the way we're training them is by creating kind of story days. So in other words, what they're learning is what it means to be Refugee Action, what it means to be a volunteer, and hopefully all the different stories of what it means to be a volunteer, they'll recognise something that they would like to be or work from. We have also realised that we need to have managers separate from directors. So we've now got a board of directors. We have re-examined our vision and our mission and clarified it. And in doing that, we understood very well that whilst our founders had an understanding of where we had been, what we needed was new directors who were closer to the refugee experience.
As an academic with a deep understanding of the global refugee crisis, what is the single most important thing that you would like to co-create with the Refugee Action Colchester team?
I think the most important thing that we want to co-create with Refugee Action Colchester is to develop a system that allows us to welcome, receive, and integrate asylum seekers and refugees in a very sustainable way, rather than always depending on volunteer or a one-off contributions of people.
With many years delivering medical assistance to those caught up in the refugee crisis, What benefits do you hope to co-create with Refugee Action Colchester?
Well, actually, with the understanding both cultures, the refugees culture and the UK culture, and the pain of refugees, because I've got some of my family refugees as well as my wife family refugees. I think we can actually support those people here in the UK. And on the top of that, with health experience and working in the NHS, supporting refugees' health care overseas, we can actually improve the public health promotion here in the UK and benefit a wider local communities as well.
Our newly equipped office means that we can meet with clients in a private space, providing confidentiality. The new resources have coincided with an increased demand for our services of nearly 200% in the last 12 months. Our work started primarily with Syrians. However, today, 70% of our clients are of other nationalities, including people from Iraq, Afghanistan, Nepal, Turkey, Iran, Nigeria, and other Asian, African, and Middle Eastern countries. Our client base has expanded to include asylum seekers, vulnerable migrants, and unaccompanied asylum-seeking children. In response to our development work, we are now focusing on delivering advocacy, education and employability, and community building. Refugee Action Colchester's vision is to create a supportive environment that enables all people seeking refuge to realize greater potential in their new lives and enjoy a sense of belonging.